Well, we have a little bit of a different setup here this morning. We're practicing our social distancing, 6 feet apart, so we're being careful. But we're joined now by Amith Scandon from the SouthEast Health Hospital. Thank you so much for joining us this morning.
It's my pleasure.
So what can you tell us about operations at the hospital now that someone has been confirmed having the coronavirus there?
Most definitely. So at the hospital, we follow the Centers for Disease Control, Alabama Public Health, and infection control guidelines to protect ourselves and protect our patients. And we have been following these guidelines way before our patients were diagnosed. And we are keeping a close watch on the recommendations with Alabama Public Health. We have been staying in close contact with them. So we are isolating our patients. The patients are in negative pressure isolation rooms, and that's where we are keeping them to protect our other patients.
So public obviously have a lot of questions and concerns. What are some of the most frequent questions you guys are getting?
The common question we get, with the response from the government requesting everyone to stay home till the end of the month, requesting to avoid crowds, many people find, is this overblown? The other question we commonly get is this similar to influenza, like the seasonal flu? There is a lot of difference, and I'll try to explain this from a higher level and come down. Human coronaviruses are not new to the human population. We have about 6 strains which we knew about from the 1960s. This coronavirus is the 7th strain, which is completely new. So there is no immunity in the human race. So this is what makes it, from the infection standpoint, a little bit more dangerous. However, 80% of the patients have milder symptoms. They are usually younger patients, but the 20% who are a more vulnerable population are older, and the older you are, the risk goes up. So when you compare the differences between influenza and COVID-19, the biggest difference what we see is in terms of the mortality rates. So influenza, it's always we hear about it, the mortality rate is 0.1%. Now that might seem small, but that is anywhere from 20,000 to 40,000 deaths per year. In comparison, COVID-19 mortality rates are anywhere between 3 to 4% according to WHO, World Health Organization. However, even some people feel that it might need a little bit more conservative estimations, which would be 1 to 2%, which is still significantly higher. Thankfully, again, like I said, 80% of the patients have milder symptoms, they recover. The 20%, which are usually older, immune compromised, those patients are at significantly higher risk. Their risk goes up significantly. As you get into the 60s, your mortality rate, if you get it, it's 3.4, then as it goes higher, it's 8.3, and then 14%. So this is why it is concerning. This is why it's not overblown. This is why, as a population, even if you are younger, you need to stay away. You might not struggle with the disease, and it might be okay with you, but we owe it to everyone around us to keep them safe. We ourselves are keeping a 6 feet distance. So all of those things matter.
Have you heard of anybody doing home remedies to try and maybe not get the virus?
There are some. I haven't heard a whole lot, primarily because I work as a hospitalist. I work in the hospital, and but you do hear about it. I've heard some patients saying that they are going to crush garlic and take it, and I don't understand where this came from, but I was kind of surprised by it. It's not going to help. You have to, the infection itself has no treatment, and that's the other part which is different from influenza. We don't have vaccines, we don't have any kind of treatment, so this is what makes it more deadly. We have to protect each other by following the infection control guidelines, washing our hands, making sure we keep at least a 6 feet difference, and staying away from crowds. That's very, very important.
All right, well, thank you so much for joining us this morning, maybe giving the public at home a peace of mind about all of this.
I understand. Thank you.
And we'll be back on Wake Up Wiregrass in just a few minutes, so stay with us.